TRIGENICS is an interactive neuromuscular treatment system. According to its originator, it speeds up the healing process, relieves pain, and strengthens muscles, all in a matter of seconds. Celebrities like John Cusack, Farrah Fawcett, and David Bowie have all benefited from it. We met with its developer, Allan Oolo-Austin, to find out more.
Let go. Breathe. Very nice. Breathing in again, and slowly out, coming down. Assuming the position.
TRIGENICS is a neurologically based revolutionary treatment technique that dramatically relieves pain, increases muscle strength, reduces swelling, and rapidly restores function to damaged or injured tissues or joints. It can be used in the rehab setting for effective treatment of injuries, and it can also be used in the sports arena.
I'm just going to lie you down real nice. Just lie down nice and easy there.
After the 800-meter race, my hamstrings both began to tense up and twitch a little bit, and I couldn't walk very well on them.
The three components of TRIGENICS are the neurological component, which involves activation of neuromuscular reflexes. The second component is a form of muscle manipulation, and the third component is a form of breathing biofeedback.
I want you to make this little noise and control the breath and breathe out. Slowly bring your leg down, bring it down. Nice and easy, nice and easy, nice and easy. Slow.
When you put all those together, they all act on the same area simultaneously. It causes a very dramatic response.
I've just fixed that one up. Now, I want you to lift and move the other one.
Okay.
Slowly. You see it?
Begins the reflex.
You see that?
Yeah.
Yeah, so this one's not, this one hasn't been treated yet.
Very quickly we had her right leg working perfectly, and then we tested the left and you could see that it was still contracting and we couldn't bend the knee at all. And then when we did the TRIGENICS, within half a minute to a minute, there was a restoration of the normal firing pattern and she was fine.
Before the treatment, my legs were very tight, and I found it difficult to stretch and run on them, and after the treatment, now they're much looser, and I feel much more comfortable running and walking on them.
Cordell, like many of the other top-level athletes that have been brought in to see me, he had an injury that had sidelined him for the entire season. What we did was the very specific work of TRIGENICS sports performance enhancement.
You won the last two races, right? You're up for the finals?
Yeah.
Okay, beautiful.
If we treat them right before they run, then there's a lot of changes that take place in the body, not only instant increase in strength, increase in range of motion, but also endorphins being released. We alter their performance and increase their ability to perform significantly.
Feeling kind of nervous. This is my first 200 of the season, so I hope everything goes well. I'm looking forward to it.
Within a few weeks, we were able to get him back on the track again, and now he's breaking records.
Hi, Lisa.
Hello.
Tell me what you've been experiencing lately.
In this treatment, the patient is an active participant rather than a passive recipient. That also makes it very different than other techniques. They're actively involved in the process, and if they're not a good patient, the treatment won't work as well.
How much better does that feel?
Much better.
Okay.
Number of visits depends entirely upon the condition. It could be anywhere from one treatment to, you know, 40 treatments.
Very nice, very nice. Bend down, touch your toes. Excellent, excellent. And how much better does your neck feel?
Oh, much better. It's nice and loose.
Good.
TRIGENICS neuromuscular exercise class started out specifically for my patients with neck and back problems.
All of these exercises are designed for you to be able to do them and incorporate them yourself.
TRIGENICS is all about balance. With TRIGENICS, we can either strengthen or lengthen muscles, and we can put the entire body into balance very, very quickly.
Pull back, breathing in. Pull back.
Allan Oolo-Austin, TRIGENICS originator, is here for more TRIGENICS talk. Welcome, Allan. I guess the biggest question I have is, how is this different than other forms of muscle manipulation like active release that we've seen elsewhere?
The distinguishing difference is that TRIGENICS is neurologically based, so the patient is an active participant rather than a passive recipient, and what we're doing in TRIGENICS is we're involving patient-controlled activation of specific neuromuscular reflexes to gain the effect that we want.
And any worrisome side effects that people have to think about having this procedure done?
None whatsoever. In fact, it's extremely safe. There's a lot of my patients that are looking to have TRIGENICS manipulation work done on their neck, for instance, rather than having some people are weary of high-velocity thrust manipulation,
Okay.
and this gives an alternative to them, so it's very, very safe.
Well, thanks once again to all of our guests, Dr. Charles Tatter, Dr. Allan Austin, Dr. John Goldhar, Michael Tamaro, Greg Myers, and as always, you. Find your balance, and we'll see you next time.